So we talked about arm liposuction, and we talked about the 3 areas of the arm liposuction, how oftentimes the armpit area is good to include it with the arms if there's some extra fat in that area as well. The arm can be a little bit tricky. Why? Because oftentimes with extra fat comes extra skin. And when you have extra skin, the question is, well, do you remove the extra skin? And if so, how do you remove it? Don't forget, when you're cutting out skin, you're creating scars. And with the arms, these scars will show. So one has to be very careful as to when to introduce these scars. But I find the arms very tricky because I would imagine that the arms is divided into 3 types. One where there's a little bit of sagging, but there's good skin quality. The second, where there's a bit of sagging with poor skin quality. And the third one, where there's a lot of sagging. So if there is extra skin, but you have good skin quality, sometimes the arm can look like it's sagging because of the weight of the fat. And I find the upper arm one of those few areas in the body where if the skin quality is good and there is fat in the area, it can look like it's sagging, but if you just do liposuction, especially if you combine it with the VASER J-Plasma, you don't need to do a lift. But there has to be good skin quality, and you have to basically imagine that, you know, the fat that's hanging is because of the fat. It's not necessarily because of the skin. Now, if the skin is sagging a lot, and usually in these situations there is some fat, but the skin is sagging a lot, it's a lot of stretch marks in it, well, that's very straightforward. You know for sure that you would do liposuction, and then you would cut this out and end up with an incision that basically goes along the whole arm like this. And, you know, we try to save these for the very loose skin, because in general I find that the scars above the elbow, most likely because of the movement of the arm, they tend not to heal very nicely. They tend to be a little bit wider, even if the person scars well. So it's important to save this long scar for people with very loose skin. We talked about good skin quality and fat, and we talked about very loose skin, and to do a lift where you have a full lift, where you have an incision that goes all the way along the arm. There is that in-between category where the skin is a little bit loose, the quality of the skin is really bad, there could be wrinkles, but it's not really, really sagging. And I find in these situations, it's very difficult because you cannot just do liposuction with VASER J-Plasma. It's just not enough. The J-Plasma helps, but it's not magic. You know what I mean? It just doesn't help. And at the same time, you don't really want to put a scar across the whole line because it's not that sagging. It doesn't necessarily deserve to have a scar. So in these situations, what we do is we do some lipo to remove the weight of the breast. Sometimes I also do VASER J-Plasma, but then I take that skin and cut it out so that the final incision is actually in the armpits, almost like lifting it up and putting the incision in the armpit. Now, in some people this works very nicely, especially when the skin is a little bit loose, especially higher up here. But if the looseness starts here, it doesn't really work very well. And I find the incisions that are under the arm, or the liposuction, when you do the lift and you put the incision under the arm, you have to be very clear with your expectations. Don't expect it to be tight like an incision of the arm here. But the advantage of putting the incision under the arm is that, well, you can still wear short sleeves and you don't have an incision showing above the elbow. So it is less limiting, but it doesn't make the arm as tight as had you had the incision along the way. In general, whenever we do any incisions in the arm, whether the incision goes all the way up or whether the incision is underneath the elbow, underneath the armpit, we often do liposuction first and then just peel off the skin. Why? because if you're going to go down and cut the skin and the fat directly from the inside, you can damage nerves, you can damage the lymphatic system. So these surgeries can be quite tricky and they have to be done very carefully. So to summarize it, I would place the upper arm laxity into 3 categories. The first category is when there's some extra fat and a little bit of extra skin, but the skin quality is very good. And in those situations, liposuction as well as VASER and J-Plasma work really well. Then you've got the third category where you've got a little bit of fat or a lot of fat, and you have very poor skin quality, and the sagging is really quite significant. And in those situations, for sure, a full lift where the incision goes all the way from the elbow to the armpit is the way to go. And then you've got the in-between, which is the tricky one, where liposuction and with the VASER and J-Plasma alone is not enough, and maybe it doesn't necessarily deserve a very long incision. And in those situations, we lipo, and we then lift it up into the armpit and have the incision under the armpit. So it's tighter, not as tight as the full incision, but it is definitely tighter, and it allows the person to wear a sleeve where the incision doesn't show.